Now, common thing that we're going to run into is the fear of discomfort, the fear of pain. So I think it'd be good to talk about how we can help people stay as physically comfortable as possible. So, what do you guys do to help people through that process if they're anxious or nervous about the procedure?
Well, I think there's two ways to tackle that question. I think first and foremost, there's a certain anxiety and a certain trepidation in terms of the actual procedure and getting through the process. And to that end, we do intravenous conscious sedation, where a patient is pretty much rendered, they're conscious, but they're in a comfortable, relaxed, forgetful state. And so that allows us to do more in fewer visits, allows us to do these type of treatments a lot more efficiently, and the patient is a lot more accepting of that. In terms of how people feel after they leave the office, a lot of that comes down to surgical technique. And but I will say that in situations where we're able to, this teeth in a day concept, when we're able to fixate something, when we're able to use the implants right out of the gate to stabilize whatever sort of temporary denture or temporary crown that we're putting on the patient, those patients do much better postoperatively, simply because things aren't moving around. And
Yeah.
and again, that's a service that we're able to offer because we have Tom, our lab technician, in the office, 4 days a week when I'm in practice.
Man, that's huge to have not only your surgical experience, your great team around you, but to have someone like Tom who's been doing this for so long and can help make this process go more smoothly for everyone and help with the aesthetics that we're all looking for. We want it to look good too.
Right. Yeah, I mean, I think these cases come to fruition and end up turning out as well as they can when you sort of work from the end result that everybody wants backwards. And so a lot of the time that we spend with treatment planning, a lot of stuff that patients don't necessarily see that you and I were doing behind the scenes between visits and before treatment is initiated, really is key to getting the results that we expect, and then I think our patients expect.